Today we're going to talk about long COVID. It's COVID-19 that doesn't go away after 1, 3, 5, or even 6 months after infection. Well, I'm about to show you some sobering data. First, my name is James. I cover trending medical information, and I'm also your go-to medical consultant, and I'll help get you back into good health if you feel the medical system or other avenues have let you down. So please like this video, subscribe to the channel, and hit that bell in the bottom right-hand corner to be notified when my new videos come out. So there was a new study released the other day by JAMA, which is the Journal of the American Medical Association. It's about people who suffered from what is called PASC, or long COVID. PASC is an acronym for post-acute sequela of SARS-CoV-2. That's just a fancy way of saying people who suffered long-term symptoms after being diagnosed with COVID-19. The symptoms that they looked at in this study involved the pulmonary system, of course, so the lungs, so like breathing issues, loss of smell and taste, anxiety, PTSD, and functional mobility. The interesting thing, if you look at the highlighted section here real quick, a total of 2,100 studies were examined here. However, of those 2,100 studies, after vetting them, only 57 of those studies, with a total of 250,351 survivors, were analyzed. So about half of these people were male and about half were female. If you look here, interestingly enough, 79% of them were people from high-income countries like America and so on. It's very interesting. What that tells me is if you live in a high-income country like me, the United States of America, USA, this data could be very relevant to you. It's important to note too, short and long-term PASC, short and long-term COVID, have not been systematically evaluated in this study. That just means, to give you one example, certain outliers or statistical anomalies in certain studies, they can sway the data, and that can sometimes dramatically change the figures in the end. So keep that in mind. Basically what that means, there are certain rare cases or extreme examples, and if there are enough of them in the study that you're looking at, the results in the end could be completely different. So one important thing to note here, the definitions of short-term, intermediate, and long-term COVID. So let's scroll through this. Let's start by defining these. The short-term COVID were the group of people who reported still having symptoms 1 month into it. The intermediate group still reported symptoms at 2 to 5 months, and the long-term group reported symptoms at 6 months. So some of these people are experiencing symptoms all the way out to 6 months. So I'm going to say this next part very slowly. Let me just explain this. So of the 57 studies that were analyzed here, in 14 of them, more than half of the people reported persisting COVID symptoms at 1 month, okay? Number 2, of the 57 studies, in 38 of them, 55% of people in the intermediate group reported persisting COVID symptoms 2 to 5 months into the disease. And the long-term group, of the 57 studies, 9 of those studies showed those people, approximately 55% of those people, experiencing symptoms at the 6-month mark. So what does that tell you? Well, let's scroll to this box plot below. Okay, so if you look at the squares in this box plot, they show short, intermediate, and long-term COVID data. If you look at the line in the middle of each of these 3 boxes, they represent a median. So what that's saying is in every group, whether that group be short-term, long-term, or intermediate COVID group, about 50% of people from these studies suffered COVID symptoms at 1 month, 2 to 5 months, or even 6 months into it. Now, if you look at these same boxes again, there are some outliers like we talked about earlier, meaning some circles that are really high and really low in those boxes can influence the percentages. But still, if you take that into account, the data still sits almost dead center. The point is, a lot of people are suffering from all of these groups, about 50% of them. Now, let's check out the scatter plot above. Let me just scroll real quick. This scatter plot shows the frequency of post-acute sequela of SARS-CoV-2 according to the country and the length of follow-up in each of these groups. Basically, it's just showing you, if you look at the bottom line, that's the amount of days people report having symptoms. So if you look at the cluster of circles, it's saying most of these people in this study report having symptoms at the 50, 100 day mark into it. When you look further to the right of the scatter plot, it shows that less people report having symptoms about 6 months into it. Now, let's keep scrolling up. Okay, let me turn to this one really quick. Okay, this lists all of the studies that were included in this paper. It shows the country of origin. It shows the kind of study, like retrospective or prospective cohort studies. Those are just basically studies examining groups of X amount of people with no less than 10 individuals. Also, it shows cross-sectional studies. Those essentially look at a patient population from one period of time. And this one here, I'll show you really quickly, that's highlighted. This is what's called a retrospective cohort study. That just means, well, cohort is a given amount of people. In this case, about 78,000 people, like I said. And it's retrospective, meaning it's looking back at it. In this case, it's looking back at people's medical records. Before I give you my personal input on this, I want to scroll all the way to the bottom where it says discussions. I'm going to read you this highlighted part, and this is going to explain what the researchers who wrote this paper believe might be causing these long-term COVID symptoms. So direct viral effects can be explained by several hypotheses, right? Including persistent viremia due to immune fatigue and paresis, like relapse and reinfection. Basically what they're saying here is that relapse and reinfection, because the immune system ramps itself up, thinks it's eradicated the infection from your body, but enough of it stays, the immune system ramps down, and then the infection comes back with a vengeance. So you get these symptoms that come and then they go, like for a very long period of time. In this case, we're talking up to about 6 months. What's the next part? Okay, so the next hypothesis is that the hyperinflammatory immune response, cytokine and hypoxia-induced injury are causing severe problems, and this is true. What we're seeing now are what's called cytokine storms. When your immune system overreacts, it sends those healing nutrients, especially cytokines, to the areas that it perceives to be really, really infected. And in doing so, and exacerbating a huge immune response, that doesn't come without consequence. That can result in certain organ systems that your body is trying to help heal. It can make it shut down. So next it's saying neurotropism using a transsynaptic spread mechanism resulting in hypoxic or hemorrhagic driven neural apoptosis. Let me break that down for you. Neurotropism, in the context of what I just said, are nerve cells, whether they be in your spine or your brain, dying because they don't get enough oxygen. They're not getting enough oxygen in this case because this disease is causing microclotting in those areas, and the clots disable the oxygen from getting to the neural cells. So this could explain a lot of the symptoms like brain fog, fatigue, problems smelling and tasting, because that's all linked to your brain. Let's scroll to the next highlighted area. I'm going to read this as well. So if you see here, no clear guidelines are currently available for the post-infectious care or recovery. There is a notable dearth, like a lack of information regarding how to assess and manage patients following their acute COVID-19 episode. We don't know what to do with it, and we don't know how to treat it. So there you go. There's all the data. I'm sure you're wondering, what's my take on this? Well, I can tell you from personal experience, we're not good at treating COVID right now. Basically, and if you're lucky enough, you end up in the hospital and someone prescribes you methylprednisolone to dampen the immune response. That's a steroid. Basically, that calms your immune system down, but the problem is you can't take steroids for long periods of time. They can really damage your body, and they have nasty side effects if they're taken for long enough. Next, we do have a vaccine, but even the vaccinated people are reporting long-term effects after reinfection. Also, another problem here, many primary care physicians are seeing their patients present with repetitive health complaints after COVID, like tiredness, depression, difficulty concentrating, problems sleeping, difficulty breathing, loss of taste and smell, stomach problems, exercise intolerance, impaired mobility, and because nothing bad shows up on the tests that the primary care doctors and specialists do, most of the patient's concerns are dismissed because there's no objective measurable data, only verbal anecdotal data from the patients. Because of that, the only treatment really being provided is a follow-up in a month or so. That's not helping the patients. You know, across Europe, they've opened many long COVID clinics. Basically, they're clinics to help treat these poor people that were dismissed by their doctors as neurotic or for having repetitive health complaints. So let's talk about the long COVID clinics. The long COVID clinics provide rehabilitative services to help people recover their breathing, to help with their cognitive impairments, depression, anxiety, PTSD, so many things that are caused by this virus. In America, we are so far behind with this, and the amount of long COVID clinics in the US are infinitesimal compared to the rest of the world. So let's concentrate on the good. The good here is that this study provides some good objective evidence to show that there are many people suffering with these symptoms well after their initial COVID diagnosis, and that something clearly needs to be done about it by their doctors. In a way, this should give a little bit of hope to the suffering people out there who really don't have a voice right now. Anyways, to wrap things up, I hope you leave this video learning something. If you personally know someone who had or is still suffering from long COVID complications, please send them this video. It may give them a little hope. And again, the data here isn't perfect, but it's definitely something to consider. And for anyone impacted by this, I want you to hear what I'm about to say. Statistics are cold comfort for the individual who is struck by lightning. So be kind, caring, understanding, and empathetic to each other. We are all human beings here. Thanks for watching, guys, and I'll see you on the next one.